Let me begin with what's fresh in your mind from what Bill said about marijuana arrest and being in your home, and unless you're out in the public somewhere smoking, you don't have to fear arrest. Well, I tell you, it depends on who you are. It depends on who you are. New York City, 2010, the police made 50,000 marijuana arrests for possession. 50,000 in New York City. 89% of those arrests were black and brown people. You ever been in New York City? There's a lot of white people in New York City too. Now, the New York City Police Department is now dealing with an issue that a lot of those searches to discover the marijuana. See, here's the interesting thing. New York State has a marijuana decriminalization law, meaning that unless I'm displaying marijuana in public, it's not a criminal offense. If the joint's in my pocket, I'm good to go, as long as I don't display it in public. But what happens is that the police were approaching these young men and women and having them empty their pockets. And these young men and women are thinking, okay, well, the police, they're asking me to empty my pockets. I'm not displaying this. They're asking me, telling me to do this, so I'll pull out my pockets. There's the marijuana. And there's the arrest. Fact. Look it up for yourself. Now, just real quick, get to my time. Again, the more dangerous the drug, I'm not about marijuana, I'm for all drugs. All drugs need to be regulated and controlled, in a sense, legalized. Not just marijuana for me. The more dangerous the drug, the more the need for regulation and control. Because what happens when we leave it in an illicit market? It becomes more dangerous. People are going to use, we already know that 40 years into this. Okay, people are still using like crazy, whether it's heroin, whether it's crystal meth, cocaine, you name it. So, in an illegal market, overdoses. In that little packet that's being sold, you don't know how much is the cut and how much is the actual drug. That's why we have so many overdoses, because you have no idea what you're putting into your body in an illegal market. There are no standards, no quality control. Let's talk about a country that has made some changes. Let's talk about Portugal. Many countries have decriminalized possession of all drugs. Portugal's one, 10 years ago. Possession of all drugs, decriminalized. And what that has done for people, it's made it, number one, easier for them to seek treatment. They don't fear being arrested. Okay, what are some of the results from other results? New cases of HIV for intravenous drug users decreased 71%. Lives are being saved. Overdoses decreased 52%. Lives are being saved. They no longer fear calling for an ambulance for their friend who's overdosing because they don't have to worry about being arrested. These minor changes of progress moving forward, these are the results. Teenage children, 12 to 15 years old in Portugal, 22% reduction in drug use overall. The next teenage group, 14 to 17, I believe it is, 25% reduction. The adult population, yes, full disclosure here, use went up a little bit, but those are adults. We need to shift our resources, our limited resources, from criminal justice to public health. These are health issues. Why do we treat someone differently? For instance, alcohol dependency. We get the person help. You know, insurance plans take care of treatment. You know, we embrace that person. We get them what they need. If you're addicted to heroin, it's a completely different story. We put you in prison. And then we say we're getting you help. That's crap. I know what prisons are about. I've seen them. I've worked in them. They are not about rehabilitation in any sense of the word. Finally, the gateway theory. It's another thing. It's crap. It's not about a drug. It's not, even some people will tell you, well, the gateway drugs are cigarettes and alcohol. What do you think about that? What do kids use first? Cigarettes, alcohol, or marijuana? What is the true gateway drug? But I say it's none of those. It's the environment. It is the environment. It is the environment. And when you have a kid who's buying marijuana, or an adult who's buying marijuana, what is the environment that they are in? They go to someone, a dealer, who usually sells multiple things, to buy their marijuana. In the environment, the drug dealer says, why don't you try this? It's good stuff. I'm not even going to charge you for it. Give it a whirl. But it's the environment, whether it's an environment of peer pressure, whether it's an environment of the illicit trade, whether it's the home environment. That has more to do with why kids use. And then lastly, because we're spending so much of our limited resources in criminal justice, there's hardly anything left to really deal with the social issues as to why people use in the first place. The child abuse, the terrible home life, trying to escape. Now, if you live in suburban America, you go to your doctor under your medical plan and you get Valium or you get whatever you want to deal with your worries. But if you're in many of our inner cities, you use what's available to you and what's easily accessed.
Take 3 or 4 questions that came up actually, the same started off with. He asked, what is law about? There are many, the question was, what is law about? And there are many ways you can answer that question. It seems to me that ultimately is about the well-being of the citizens who make it. Their well-being is not going to be improved with increased drug use. You all know that when the costs and risks of something are high, less of it gets done than when the costs and risks are low. If you remove the legal barriers to drug consumption, the costs and risks of consuming will come down and more will get consumed. That's the way the world actually works. Major Franklin also asked, what happens when you put people in prison? There's actually a quick and easy answer to that. The answer is crime goes down. We have 20 years experience in this country with knowing what happens with increased incarceration. Incarceration has increased massively from the last 20 years. I think it's gone up by a factor of 4. What's happened to the crime rate? With all those people in prison, what's happened to the crime rate? It has fallen by half. There are half the murder victims, half the victims of aggravated assault, half the victims of theft, half the victims of robbery now than there were 20 years ago. And the reason is, or a significant part of the reason is, people went to jail for it, and we are now safer for having done it. But the main thing I want to talk about was when Major Franklin said, quoted in points that there's a saying, you'll get over an addiction, but you'll never get over a conviction. I actually do have some experience with that. At one point in my career, I was the counselor to the head of the Drug Enforcement Administration. The DEA holds a yearly ceremony to commemorate and honor agents who are killed in the line of duty. We invite to these ceremonies people on the outside, people in private life who have contributed to the fight against drug use. And we invited one person, one lady in particular, a mother whose 16-year-old daughter had died of a methamphetamine overdose. The story with her, with this young girl, started meth at age 13. And again, as Major Franklin points out, this was a suburban girl. What was tried initially was treatment, counseling, the 12 steps, going away to rehab. That was tried repeatedly with this girl. Eventually, but it didn't work. Meth is an extremely addictive drug. It's very, very hard to break that addiction, and it did not work. With the non-criminal answers, eventually she was arrested And she did go to jail for a short time, but by that time it was too late. Her addiction was set in, and she died of an overdose at the age of 16. Her mother had gone around the country at her own expense to talk about her own daughter's experience with drugs. We invited her. I went up to her at the reception we held after this event. And I thanked her for what she had done, how she had given of her own time and money. I thought that what she would say to me was, I'm happy to do it, the message needs to get out. Whenever I talk to the high school kids, I think, that could be my daughter. But that is not what she said to me. What she said to me after I said that, she just looked at me with a blank face and said in a dead voice, if you'd arrested her earlier, she'd be alive today. Why didn't you? Now, I was a nimble lawyer most of my career. There were very few times I wasn't able to speak on my feet or come up with an answer. But I did not have an answer for her, because I knew what she said was true. If we had invoked the power of the criminal and arrested her earlier, her daughter would be alive today. I went into the DEA simply having been a retread assistant U.S. attorney and believing that if Congress passed the law, it must have, something behind it. I did not become an actual drug lawyer until I had to come up with an answer for that label. And I couldn't come up with one. And after about a 10-second pause, I mumbled, well, we do the best we can. If you had been in my shoes in that encounter with that mother, you would think differently about standing down from the use of criminal law.